Okay, perfect. Thank you. Hi. As Richard said, I'm Alice. I'm doing my PhD at King's College London. So the ART-CARMA project is relatively new in terms of we've just started data collection. And I also only started my PhD 2 months ago, so I don't have much in the way of results to update you all on. It's mostly going to be sort of the procedures of the ART-CARMA study. So first up, just a little bit of background about ADHD. So ADHD is a neurodevelopmental disorder that persists into adulthood for a significant proportion of those clinically diagnosed in childhood. And we're also seeing an increasing rate of individuals diagnosed in adulthood. And it's typically characterized by symptoms of inattention, hyperactivity, impulsivity, and the prevalence is estimated to be about 2.5% worldwide. So adults with ADHD have an increased risk of developing so-called cardiometabolic illnesses, and our study aims to improve our understanding of these risks and best improve future health outcomes. So many adults with ADHD are offered medication as part of their treatment, but we need to learn more about the longer-term effects of this medication and how the medication, individually and combined with physical activity, can contribute to a healthier future for adults with ADHD. So that's kind of where RMT comes in. So as I'm sure you're all aware, RMT is changing the way in which many conditions are assessed and managed. So through combining sort of active and passive components of RMT, allowing for continuous collection of real-world data, we hope that this project can contribute and transform the clinical practice for adults with ADHD. So we initially conducted a pilot study around 3 years ago now, where 40 participants took part. So it was 20 adults with ADHD and then 20 controls. And for a 10-week period, they took part in remote monitoring. So they wore the Fitbit, and then they also had the Radar passive app downloaded on their phones. And then in terms of the active monitoring, there were a couple of cognitive tasks, and then the Radar questionnaire app, where they would answer questionnaires at weeks 2, 6, and 10. And just a couple of examples of some of the initial results that are coming out of the pilot study. Heat, who's speaking in a bit, conducted this analysis and found that individuals with ADHD took significantly longer to answer the questionnaires than adult controls. So they received notifications to remind them to do the questionnaires. The adults with ADHD took significantly longer to respond to that. And then Haley, who couldn't be here today, looked into the sleep data and found that there was significantly greater variability in the sleep duration for adults with ADHD when compared with controls. So this is just a kind of idea of the initial things that we've been looking at for our pilot and where we can take ART-CARMA. So the ART pilot was sort of looking at initial feasibility of using remote technology to study adults with ADHD. Many of the sort of symptoms of ADHD could be seen to sort of interfere with remote technology, so losing devices, forgetting to complete questionnaires. So it was initially to sort of assess feasibility in this sense, and then we're hoping to build on that with ART-CARMA to replicate the findings in a larger sample. So ART-CARMA is also a non-interventional study, so we're just observing how adults with ADHD sort of go about their life for a 12-month period. And across the 2 sites in London and Barcelona, we aim to recruit 300 adults, so 150 in each site. And there are 2 main aims of ART-CARMA, but to sort of just summarise, the first one is to look at how ADHD medication treatment and physical activity individually and jointly may influence cardiometabolic risks in adults with ADHD. So a big part of time span, which is the wider project that ART-CARMA is a part of, is focused on cardiometabolic risk, so specifically cardiovascular disease, type 2 diabetes, and the link between cardiometabolic risk and ADHD. And then the second aim, in summary, is to look at medication adherence. So why people may decide to discontinue their medication, and sort of reasons for non-adherence. So these are the measures that we will be looking at or using in ART-CARMA. So in ART-CARMA, with the wearable device instead of the Fitbit, we're using the Embrace Plus, Empatica's Embrace Plus. We're also still using the Radar passive app. And then in terms of the active monitoring, it's still the cognitive tasks and the questionnaire app. But we've added a couple of other measurements as well, which I will get to in a second. So as I said, it's a 1-year study or 52-week study, and the 4 weeks there is highlighted because one of the really special things about the ART-CARMA design is that individuals, when they're recruited and when they're enrolled into the study, won't be on medication. And then at the 4-week mark, we're working it out with the clinics so that at the 4-week mark is when they'll begin their ADHD medication. So we'll have a kind of pre-medication reading for the active and passive components, and then obviously in the 11 months following up as well. So the study period starts off with 2 virtual baseline assessments. And the first baseline assessment kicks off with some clinical interviews. So this is clinical symptoms of ADHD, but also co-occurring disorders of anxiety, depression. There's then IQ and working memory tests, and then demographics questionnaire. And then in the second baseline assessment is where we set the apps up on the participant's phone, to help them get familiar with it, teach them how to use them. So we have 3 apps. In ART-CARMA, we have the Radar Passive app, Radar Active Questionnaire app, and then the Empatica Care app, which is the app associated with the Embrace Plus. We then ask them to do the first batch of questionnaires while we're with them, just in case they have any questions. And then they then do the cognitive tasks. And then after the second baseline assessment is when the continuous passive monitoring starts. And in terms of the active monitoring, they're asked to do a batch of questionnaires every 4 weeks throughout the study period. And the questionnaires consist of several mood measurements, depression, anxiety, and then behavioural measurements like diet, alcohol use and smoking. And then to tie into the cardiometabolic risk factors element of the aims, we're also asking for their blood pressure and weight each 4 weeks. And then every 4 weeks as well, there's also a speech task, which is using the same protocol that Nick has already spoken on. And then within each 4-week period, there are also even more questionnaires that we're asking them to do. So every week we ask them to fill out a side effects questionnaire. And then every day we ask them to fill out a medication use questionnaire. So this is, have you taken your medication yet today? If not, why did you decide not to? And if you did, what medication did you take? What was the dosage? And when did you take it? So we'll be having this information daily for a year. And then with regard to the cognitive tasks, these will be at baseline and then at months 6 and 12, so weeks 26 and 52. And then at the end, we'll be conducting debrief interviews with all the participants just to get any feedback. If there's anything that surprised them about taking part, anything that they found particularly burdensome, or any, hopefully there'll be some benefits that they found as well to taking part. So this is the passive monitoring. So like I said, we have the Embrace Plus here. So this has many passive measurements, oxygen saturation, heart rate variability, sleep, physical activity. So this will all be looked into, especially with relation to cardiometabolic risk factors. And then we also have the Radar Passive app, which again has the sort of standard measurements that you'll be familiar with, but yeah, sort of background noise, background light, relative location, phone usage, time spent on phone. And then obviously we will combine a lot of the passive monitoring elements as well with active monitoring elements to sort of create a picture of the experiences of adults with ADHD in their first year of medication. So this has been a very brief introduction to ART-CARMA. There's a lot of facets to it, but if you would like a bit more information, this is the protocol that we published recently. So there's more information in there. And as I said, we're only sort of recently into data collection, so we have a bit of a way to go, but if you want, again, more information or when we start to have results and start publishing those will be on the ART-CARMA KCL website. And shameless plug, because I run the Twitter account, if you would like to follow us on Twitter, go up there. We have introductions to our collaborating clinics, the procedures that we use, and also a bit more information about the wider team, some of whom couldn't be here today. And then, yeah, speaking of the team, thank you to everybody at King's, and then also our colleagues in Barcelona, and then sort of in the wider time span group. Thank you very much.